healthcare providers in the community, our patients in the community. We serve our employers in the community as well, because you have unique healthcare needs, and BayCare is glad to be able to be a resource for you. And if you would, let me know when you can see my slides. Gotcha. Thank you. Boy, we've been on a journey in the past few years. I love the saying that somebody reminded me of the other day that we used so much when COVID first came, of building an airplane while you're flying it. Don't you feel the same way as an employer, as you were looking at your response to your workplace? But you know, here we are now a few years later, and we're able to look back and reflect and just kind of see what were some of the other collateral things that happened out of COVID. And with lockdowns, not traveling, especially international travel, use of the measures to prevent the spread of one particular virus, COVID, poof, all the other viruses went away. So we've been through a lull period where we just really did not see a lot of the typical cold and flu season respiratory viruses, and the subsequent absenteeism from work that happened. Thank goodness we didn't have that, because we were struggling to hire and get staff to be there as it was. Um, but we really went through a period there where we did not have a lot of different viruses that were circulating and that we were coming in contact with. But I've thought about this, the old song, "What goes up must come down." Uh, the same thing with the evolutionary pressure and the biology of viruses. They have a drive to survive and to replicate and multiply the same as any other living organism does. So, yeah, they definitely came back again. Came back with a vengeance when we got to influenza. Very busy graph. So I'm not going to go through this in detail, but really what to look like is that kind of big claw looking thing over there on the top left. That's our current influenza season that we are just now pulling out of, where we didn't have one in that very bottom line down there last year or the year before. And you see, we consistently will have heavy flu or light flu activity. And I'm sorry, this is not just flu, this is all viral respiratory infections in general. But especially this year, that trajectory of how quickly it hit and how severe it was very unique. It's interesting that if you don't go to the gym, your muscles start to get a little weaker, and they're not at their peak performance because of that lack of pressure on the musculoskeletal system to stay in tip-top shape. There's a lot of science right now that's being explored around the concept that our own immune systems and our ability to fight off viral infections, we went through a period where it wasn't going to the gym. There wasn't a lot of virals invading our body and causing our immune system to respond. And so it's not that our immune systems got weak, it's just that they do what every other biological process does in our bodies. They kind of go on to a hibernation mode. They're ready to bounce back when they need. But there's some thought that how severe the flu season and the respiratory season has been right now is that people that hadn't been using their immune system as much didn't have it ready for them. We see this, and you can think of how many people yourself or that seem to have been a lot sicker the past couple of months than typical, and that their infections tend to be a little more severe and last a little longer. Not complaining when we compare ourselves to where we were a few years ago, where everybody was with COVID was in the hospital and facing death. At least we're not there. But the burden on all of us for not having as much of a challenge for respiratory infections came back with a vengeance. And it came back in the form of what is actually termed the trifecta of respiratory viruses. We still have some COVID out there, and we still have some influenza out there, as we always did. But RSV, respiratory syncytial virus, this is a virus that normally affects the pediatric population, causes a lot of congestion and inflammation in their lower airways, pneumonia leading to hospitalizations. Adults are generally immune to this. We get it, and it's just like any other little common cold. But RSV in the adult population was very strong this year. And while we didn't have COVID clogging up the hospitals and the EDs and the urgent cares, we saw a lot of RSV and influenza this year. You may again have saw that with the increased number of work-related illnesses, respiratory personal illnesses that you were being asked to accommodate. Why does this matter to you? Good study here, if you want to look at it, actually puts in numbers, the economic burden to business with this. But you have not only just the people, I can't come to work today because I'm sick. I can't come to work today because my child is sick and I can't take him to daycare. Uh, Worst, the middle one here, they come to work, but there's our presenteeism. They're there, but they're not productive. They're not really doing much for us. Um, the how long am I contagious question, that how soon, once they're ill, can we get them back to work? We're a lot more cautious, as we should be now with COVID, but we still have sometimes overshot it and said you can't come back to work until you're totally asymptomatic. A pearl there is that you generally know you're safe to come back to work if it's been 24 hours with no fever, at least 3 days since the onset of your illness, and you seem to be feeling better. It is not required that they have all symptoms resolved before they can return to work and not be considered contagious to your fellow workers. The other is that with a lot more people being ill, there was a lot more doctor visits, a lot more use of healthcare resources, which is going to impact your claims data for your healthcare, for your employees as well. So what do? Let's learn from our experience recently. Just like after 9/11, we never went back to where people just walk on airplanes with no screening at all. I don't think we're ever going to go back to where we were as a society or an employer before we had COVID. But let's try to break some of the old habits. Uh, the picture here of the person checking their pulse. I don't know about you, but in healthcare, there was always a word that said, if you have a pulse, you better show up to work. So that's one of the old habits we really should learn from COVID and break. If your team is sick, let them stay at home. They need to stay at home. Although a lot of times they don't want to. So we have to kind of help nudge them and point them in the right direction. And again, stick with what we have found through COVID that works, not to the same degree where we have lockdowns and universal masking. Everyone has to have a tape measure out with at all times with 6 feet of distance. We're past all that. But whenever you are seeing that you have a number of your coworkers that have been ill, that's when maybe I want to kind of, well, let's temporarily kind of do some of those measures again, maybe and rethink our cleaning in the workplace, making sure we have masks available for those that want to take them. And then where possible, if that person can legitimately work from home, that may be an option for them as well. So the trifecta of flu, COVID, and RSV has been one of the outcomes from what we had with COVID that we've been facing recently, and thought that this might be information of use to you, informative, and would now welcome any questions that anybody may have. I like to say this is the audience participation part of the presentation. So there's always somebody out there.
We do have a question. What are your thoughts about keeping mask mandates in medical offices?
That's a great question. Hotly debated over the past 3 to 4 months as we started saying, well, everybody knew it was time to start relaxing some things, but relax what and how much and when. Mask usage was really one of those. Uh, um, I do not think that universal masking of asymptomatic people across the office at all time for your workforce or for those you're serving, even in a medical office. Where we are now is, look, we will provide you with the resources to protect your health. You know your health. You know what is best for you. If you feel like you need to protect yourself 24/7, here's the mask, here's the resources to go do it. But we're not going to require you to do so. And we're also not going to require patients anymore. If somebody is hacking and coughing in our lobbies, we ask them, would you please wear a mask or wait outside? But we're not going to refuse them care anymore like we did before. The next question I see is, can you test for RSV like you can for COVID and flu? The answer is yes. Very similar technology, a nasal swab that will be able to test for it. In the adult population, just like we do COVID test and flu test on individuals because there's medication I can give an adult, there's not a medicine for an adult or a child for that matter for RSV. So we don't have a in-office, we don't use an in-office test for just all the other viruses other than COVID and flu. RSV is lumped into that. So while we can test for it, and in adults, it's not routinely done in a healthcare facility. The exception to that is pediatrics, especially high risk medically complex pediatrics, because those patients may need to be admitted to the hospital. We can test, but it's not routinely done.
I have a question related to pediatrics. I have a bunch of young children at home and just curious on your thoughts on when does it go from a cold to a virus to, we should definitely take them into the doctor because as you know, kids get sick very often. And as parents of multiple children, it's sometimes where's the line there?
That line is, oh boy, I tell you, that line, because it's not only the desire and the knowledge you need to do the right thing for your kid, it's the guilt if you get it wrong. You know, that's part of it
Yeah,
as well.
absolutely.
Did I go to the doctor too quick, or did I go to the doctor not soon enough? Uh, Hard to dial in on. Here's the general recommendation for your children: treat their symptoms. They don't need an antibiotic if it's a virus. They may be sick for 10 to 14 days, coughing and hacking and miserable. And boy, that's hard for a parent to sit back and say, I need to attack that. But an antibiotic's not going to help them. And seek medical use appropriate over-the-counter medications, which is another controversy right now. But use appropriate over-the-counter medications, following the directions. Give them plenty of fluids, try to restrict their activity. If their fever's uncontrollable, if they're having difficulty breathing, and if they're not eating and drinking. Those are the 3 signs that says, now's the time for me to take them in and get them checked. Next question is, it seems like there'll be an annual vaccine for COVID. The answer is yes. We're moving very quickly, just as both influenza, the mixture of what subtypes of influenza virus that are circulating changes every year. So the vaccine against them has to change every year. We've heard all about the different variants in COVID. That's where it's changing. Yes, we do believe that we will need an annual vaccination for COVID, and that we will very quickly, when we get our flu shot, along included, it'll be a flu/COVID shot. It'll be a 2-in-1. I'm sure there'll be single doses available for people that prefer one or the other, but mostly it'll be 2. And then we think about remember the The COVID vaccine is an RNA vaccine, a brand new technology that really was a miracle for us that we were able to find it. Otherwise, we would not use it. Otherwise, we would not have had the COVID vaccine as quickly as we did. But there's a lot of research right now and drive around creating a one-shot vaccine for viral illnesses. You don't get your tetanus shot every year. You get it once every 10 years or so. We're trying to move to just a once every decade shot that would cover for not only influenza and COVID, but a lot of the other respiratory viruses as well. The next question, it seems like everyone is getting sick these days and nobody knows if it's COVID or not unless they get tested. Amen. Um, it's because now the knowledge that you have COVID is now probably important because you don't want to spread it to those around you. You want to take, but shouldn't you do the same thing if you're sick with any other respiratory virus? Isolate and protect others. If you're not at someone at high risk of complications of the flu or any other respiratory virus, you're probably no longer considered to be high risk of COVID, and you're not going to be placed on a medication for it. So unless you're having uncontrollable fever, respiratory difficulty, or can't keep down food or liquids, you probably really no longer need to get tested for COVID. Treat the symptoms and wait it out.
Can you talk a little bit about the season? I know you mentioned this in one of the previous slides, but it's starting to get warmer outside. We're all looking to spring break and warmer seasons. We used to have a flu season. Can you talk a little bit about that?
Sure. Um, the reason traditionally that we have a season for respiratory illnesses is that we tend to congregate into groups indoors. We're in closer proximity for longer periods of time than we are during the summer months. Uh, the current season, as I kind of showed you on the previous slide, it hit out of the blue. It hit quickly. It's gone away just as quickly. And by quick, I mean over the past 2 weeks, the epidemiological data coming out of the health departments in our four-county Tampa Bay area shows that influenza is almost down to negligible levels in the community right now, as well as COVID. What about folks with high risk factors for complications? They're told if you have a high risk factor for complication, your doctor's probably already told you, if you get a viral upper respiratory infection, I need to hear from you. I need to check in on you. Yes, we do treat those individuals totally different. They do need to be tested and where appropriate, have medications prescribed directed to which virus they may actually be experiencing. Is Paxlovid recommended to help with COVID infection? Yes, but maybe not for everyone. Your 20s and you have mild COVID symptoms, like any other medication, Paxlovid is a drug. It does have potential side effects. And if those can be avoided, they should be. That's really no different than what we used to tell people with Tamiflu. You really should not be taking Tamiflu unless you have risk of complications or other extenuating circumstances. Paxlovid's also a drug that it can interact with so many other medications that sometimes you're better off not taking it than taking it. So that's why it's important if you are one of those that have high risk factors for complications, that's a joint decision that should be made between you and your healthcare provider on the use of Paxlovid. I personally think it is a great drug. I prescribe it, but where appropriate, not as a shotgun approach to every single COVID virus that's out there.
We can give it just a second. If there's any other questions, I don't see any more in the chat.
Are people with diabetes more prone to respiratory infections in general? The answer is yes. Uh, you can say with diabetes, whether it's a respiratory or a viral infection, a bacterial infection, or a fungal infection, the three categories of infectious organisms, diabetes imbalances in the blood sugar, and so many of the other metabolic triggers that causes that we're just beginning to understand. It definitely makes your immune system a little more sluggish. So yes, they are more prone to getting those. Early on cruises were nest egg for COVID. Is that still an issue in today's changes? You take people that normally are outdoors and not in close packed proximity during the summer, and because of the weather, you bring them indoors and they're spending longer periods of time closer together. You do have that's a prime advantage to a virus to be able to spread and replicate. You put all of those people on the cruise ships, whether it is COVID or the other one that we hear so much about, norovirus, the one that causes the stomach flu. So cruise ships are always going to be, just by nature, more prone to viral spread. That's an instance where you need to be aware of that and take your precautions. A lot more hand washing, a lot more hydration. There's a question, is there an RSV immunization for babies? There is not. It's a holy grail because of the morbidity and mortality that it causes to that population, but there has yet to be a effective vaccine for RSV developed. Bacterial infections, meningitis, so many of those, we've long had effective vaccines, but the viruses, because they mutate so frequently, they're tricky to get a vaccine for it. Look at how long they've been trying to get any kind of vaccine for HIV virus. So the answer to your question, no, there's currently not an RSV immunization for anyone, babies included.
Well, thank you so much. Oh, another one. Good. Some jobs require you to be vaccinated along with cruise ships. Why is it that no longer an issue?
Healthcare providers, they need to be sure that they are not transmitting infection to the patients they're serving, especially if they are a high risk patient. So those people that fall into those categories, so EMTs, paramedics, nurses, doctors, etc., that community, along with one like the cruise industry where there was that high risk of spread, there was at one point universal mandates. Whether you wanted to be vaccinated or not, you would be vaccinated or you didn't have a job. That's only still in existence for certain Medicare institutions as a participation in the Medicare program for hospitals. Ambulatory doctors' offices no longer apply to that. It's now encouraged. I'm sorry, it's encouraged, but it's really it's not required as long as it was before. Why is it no longer an issue? Because COVID is no longer as much of an issue as it was. It's still there, but it's not causing high rates of hospitalization and high rates of death. So it's now, as I said, around masking and social distancing. Know your own risk and protect you make decisions about what's best for you as opposed to having someone else dictate it to you. The question is, if a child has had a cough for more than a couple of weeks, is it reason to be seen? The cough isn't as bad as in the beginning, but it's definitely lingering. RSV is one of those, along with some of the other viruses. They call what's called a post-viral, so after a virus, bronchiolitis. This is inflammation and just irritation. It's just raw and irritated, like it's got a sunburn down in the deepest little bronchial passages, but it's not in the lung. It's not pneumonia. They may or may not even be bringing up phlegm, but they rattle, they wheeze, they cough, they cough, they cough. And you're just like, would you please quit coughing for a little bit? And you feel for them because maybe they're not getting the quality sleep and everything. As long as they are eating, they don't have an uncontrolled fever, and they're not having signs of difficulty breathing, let the cough go. It can take weeks before they go away sometimes. Very difficult to hear that when a doctor tells you. I understand because we want to fix things. That's our nature. And an antibiotic will not fix it if it's a virus.
Thank you. I believe I did post the link for our next BayCare Presents in the chat. It's going to be on the Blue Zones, lessons on longevity. So that will be a good one for Nutrition Month. So we're excited about that. I do not see any questions, but we thank you, Dr. Waldrop, for being on today. We thank everyone for being on the call. Um, and we appreciate your time and guidance as we move out of and we thankfully move out of that high peak area that you mentioned this season. So hopefully we can continue some of the hand washing and stay away from the doctors with all these viruses. So we appreciate that.
Thank you all very much. Have a great day.
Thank you.